Hi, Mike Savilla here from dranonymous.com, and I'm very excited to share this video here with you. It is an interview with Dr. Kevin Foe from KevinMD.com, arguably the most influential blog in the medical blogosphere. This interview was recorded on January 19, 2011. And this interview here is broken up into 4 parts, and I do have to tell you that this original interview was twice as long, and I cut out a lot of stuff, so I left in the best stuff here for you to check out. So the first part is Kevin's upcoming keynote address at the Texas Medical Association meeting, which will be on January 29, 2011. The second part of the interview, we talk about health policy issues like healthcare reform, healthcare repeal, what we think will be the leading issues when it comes to the 2012 election cycle, especially the presidential race. And we also talk about the Medicare SGR, which Congress is continuing to ignore and push back. Good discussion on that. The third part of the interview, we talk about just about the state of the medical blogosphere in general. And the last part of the interview is something very fun. I call it the Ask Dr. Anonymous segment, and he asked me a couple of questions that he or his readers were curious about. So I want to thank Kevin for the interview and for the time, and I hope you enjoy this chat with Kevin MD. I start out by asking him what is he going to be talking about during his keynote address at the Texas Medical Association.
Sure. Well, I think it's a tremendous opportunity, like you said. A lot of medical associations, like the Texas Medical Association, American Medical Association, they're getting into social media. They want to educate the members about the power of social media and how it intersects with healthcare. So they asked me to speak in the winter meeting and talk about the basics of social media and how it relates to patient care. And one thing I'm not going to do, Dr. A, is convince all of them that they need to jump on Twitter, Facebook, or start a blog.
Yeah.
Because we both know it takes a lot of time and commitment to do that. And let's face it, these are busy docs, who has the time to do that?
Right.
But I do think it is important to at least keep them up to date and let them know what the current trends are in social media and healthcare, because that's where patients are going to be. If you look at the data from the Pew Internet and American Life Project in 2009, 61% in 2009 of patients there going on the web looking for health information, and that number is only higher today. So I think it's tremendously important that doctors need to also get online to guide these patients through the chaos of health information on the web. And I think that's one of the biggest points I'm going to make during my presentation. I'm also going to give some real-life examples of how doctors, hospitals, and other medical institutions are using blogs, Facebook, and Twitter, and see how they can relate it to their practice. And also, I'm going to talk about it from an advocacy standpoint. The Texas Medical Association, obviously, they want to influence the health reform debate. And I'm just going to give some examples from what I did to help do my part in contributing to the health reform conversation, talk about how we can bridge that gap between social media and mainstream media, and how people are just interested in what doctors have to say. Television producers, newspaper editors, they're all interested in what docs have to say. So I think starting with social media, it's a great way to get their attention. So I think those are some of the major themes I'm going to try to highlight during my speech. The Texas Medical Association is a tremendous honor to speak in front of the members, and I go across the country and give grand rounds, giving the basics about social media, talking to other doctors. I think as a physician, you definitely have that perspective that obviously other doctors can relate to. So last year, I went to a hospital in New Jersey. In April, I'm planning to go to Vanderbilt to speak, and I think that a lot of our other social media colleagues on the web. Brian Vardabedian at 33charts.com. I know that he speaks nationally, and plenty others. I know that you get invited to speak on panels on a national basis as well. So I think that there's definitely a demand for social media savvy doctors to really speak about their experiences because I think coming from us, we're going to have more influence on our fellow physician colleagues.
Let's kind of switch gears here a little bit. As we record this this evening, the House voted to repeal the healthcare reform or overhaul, or however they're characterizing this. Let's talk a little bit about health policy and. Now that there's already people who are jockeying for the 2012 presidential race, kind of what are you seeing from your readers and the people that comment about health policy type issues? Obviously, the economy in this country right now is still number one, but presuming that the economy does turn around a little bit, do your readers think, or do you think that healthcare is going to be the number one issue for the 2012 election, or something else?
No, I think healthcare for the foreseeable future is going to be one of the top priorities on people's minds. I think the economy is number one, but healthcare I think is definitely in the top three because the burden of healthcare costs is on everyone's mind. And this year, especially in January, you have a lot of people changing insurances. They're having higher deductibles, and they're just getting fed up with the costs of healthcare. And so I think that it's definitely going to be on people's minds. When it comes to health reform, obviously it's still polarizing. Whenever I write a health policy post, or if I have a guest post talking about the health reform bill, you're always going to get people from both sides. They either love it or hate it, and there's really no middle ground. I think in the next few years, I think we're going to be talking about the implementation of the Affordable Care Act. It's very unlikely it's going to be repealed. I think today's House vote is more symbolic, but I think in the next year or so, we're going to um, navigate the difficulty in implementing it. So, a couple issues with that, is the individual mandate, is it constitutional or not? And are the conservatives going to continue to chip away at it as it's being implemented? I think there are a lot of moving pieces. I think that it does have a long way to go in terms of making it more effective. Um, but I think I always call this it's kind of the better than nothing law right now. I think that I've come out in the past and says I do support it, mainly because it's better than the status quo. It's better than nothing. I think that it can always be improved. There's still, I think, plenty wrong with it. If you look at what's happening in Massachusetts, I think that's really kind of a foreshadowing of what's going to happen in the country. And whenever the individual mandate kicks in and we have 32 plus million newly insured patients, it's going to strain the healthcare system. I don't think that there's enough primary care doctors or providers to see them. So I think that it does need to do more for primary care. And I think that the next year we're going to it'll be an interesting year to see parts of it being implemented and see what gets pulled back. So it's definitely going to be on everyone's minds.
And let's kind of switch gears again to just kind of in general the medical blogosphere in general. And there's been every year I read this as far as are blogs dying? Are people reading that stuff? Are we overwhelmed with blogs? Or are people on social media moving towards other things as far as Facebook and Twitter and video and audio and all this other kind of stuff? And kind of what do you see as far as in the medical sphere itself, as far as in social media? Are blogs still kind of the place to be, or are you kind of seeing a diffusion of that kind of social media?
Well, like you said, I'm pretty old school, so I always think the blog should be the core of the social media experience. But you're right, blogs certainly aren't growing as they once did. They're still growing, but not at the rate that they did a couple of years ago, because the barriers to adoption, to adopt and start a blog, is actually pretty big when you compare it to, say, Facebook or Twitter. With Twitter, you just simply sign up for an account and you're on. Same with Facebook, and they're both free. So I do think that um, if doctors want to participate in social media, they're going to take the path of least resistance, and that could be Facebook and Twitter. I don't think that there will be as many doctors blogging, but I think there's always going to be a place for it, because there's always going to be a place for long form social media, is what I call blogs. Like, there's only so much that you could write on Facebook or in 140 characters on Twitter. It's an interesting question. Down in blog world back in October, I discussed that question, whether Twitter was going to complement or compete with blogs. And I think the consensus that we came up with was that it was going to be a little bit of both. I don't think Twitter, for instance, and blogs, I don't think it's an either or. I think they complement each other. And I think that if you're going to have a complete social media persona online, you got to have dabble into a little bit of everything, because there are people who just get their information on Twitter. There are just people who just get their information on Facebook, and there are just people who read blogs. So I think you need to dabble in a little bit. So I think, to your larger question, are blogs dying? And I wouldn't say they're dying, but I think that they're probably not going to grow as fast as they once did.
And do you think the barriers that will still be there for physicians, are things like privacy and liability and payment using social media, maybe not just for patient communication, but just kind of in general?
Well, I think that they need to see value in it first, and I think that's what you and I try to do. When I speak to other doctors, I try to show them how it could impact the way they can care for patients, how they could improve their practice. So I need, well, number one, they need to see value, and then number two, once they see the value, they need the time to commit to it. And a lot of doctors simply don't have the time. They're going to see social media as one more thing that they have to do during the day, and until it gets valued by Medicare and the insurers, and social media is seen as a way to better connect and better care for patients, it's going to be very difficult to have the majority of physicians adopt it. I think the rate of physicians adopting social media will continue to be gradual. I still think a minority of doctors are going to be doing it. It's going to be a while before we get to that tipping point. But I think that adoption is going to be slow. On the flip side, I think that the adoption from medical institutions like hospitals and university medical centers, I think their adoption is going to be much faster. And it could be from hospitals and large integrated care organizations that really push these physicians to join them. Um, I think one other issue is whether there's going to be a physician-only social media platform, something like a Doximity or Ceramo, iMed Exchange, and I know the American Academy of Family Physicians are just starting one. Is there going to be that definitive physician-only social media site? And I think the jury's still out on that. Again, it's going to come to whether the majority of docs can adopt a single platform to make it worthwhile, because a social media platform is only as good as the number of users that are on it. So you're going to see a lot of these sites fight for a physician audience,
Yeah.
and right now it's going to be very difficult to see one winner coming out of that.
So we get to the last part of the interview here. Something that I'm introducing here to my peril. No, I'm just kidding. So this is the Ask Dr. Anonymous segment, and what I'm going to be doing, asking my guests, is if you or if any of your blog readers have questions about Dr. Anonymous, and I will do my best to answer them.
All right, so I have a couple things that I'm interested in.
Sure.
I guess a lot of doctors who are involved in social media, like you and me, and you obviously do a lot with the Dr. Anonymous show, and now you're kind of a TV star locally, and you're on the cover of Medical Economics. So I guess the question is, how do you balance um, your professional life, social media life, and family life, and how do you balance all three? Because I'm always interested in hearing tips on how busy physicians can do that.
Yeah, it's been a struggle for me, um, because there are things that we're doing at the office now. Like a lot of other doctors, we're integrating electronic medical records, and they have asked me to take a key part of that. Imagine that. And in the hospital, we're doing more electronic things, and they've asked me to help out with that. So balancing all of that has been really difficult for me. But especially the social media part. Well, actually a lot of things in my life. As I say in my show, I'm passionate about medicine and I'm passionate about social media. So trying to balance all that has been difficult for me. How do I do it? I make mistakes every day. But from my standpoint, patient care is the primary focus. So I try to, do things like my notes, do things like my messages. I try to put that at the top of my list until I just get tired of it at a certain time of day. And then I try to do most of my evenings doing away from medical stuff, away from work stuff, to just try to clear my mind. So that's kind of where I try to fit in some of my social media type of things, social media projects, and then also with my family things. So I guess I try to do it by just saying, from this time to this time, I'm working, because as you know, and a lot of other busy doctors know, there's always work at the office to do. And there's no way that you're going to catch up. You just have to bide your time and just prioritize and say, what is the most important thing I got to do during this workday? You get that done, and then you just kind of move on and take care of your other projects, if for anything else, to try to keep burned out. And I don't know how people blog every day. Busy people who do stuff every day. Because I don't write a blog post every day. I used to when I started. That's when I was really passionate about things. But I don't do that much anymore. I guess I do more kind of like passion writing. So if something I'm really passionate about, it really upsets me, or I'm really feel strongly about, that's when I write a blog post. That's when I record a video. And I don't do a lot of editing. I'm kind of a one take type of guy. I know a lot of people, they just micromanage every single comma and period and everything, and I don't do that because just for me, I just think it's more genuine. I just take it once, I write it once, I send it out there, and then I just go move to my next task. So I guess it's a lot of other things. The way a lot of other people try to manage their tasks is to try to have some kind of priority system. But for me, I just try to block out the time and say, from this time to this time, I'm doing this. And even though I'm not 100% done, I move on just for anything else to save my sanity.
No, those are great tips. Cass, do I got one more question?
Sure, go ahead.
All right. So I guess the other thing is that you're obviously on the cover of medical economics, and every week you're on the local television show. And I think that's a great example of really bridging the gap between what you do on social media and going into mainstream media. So I guess, could you offer any tips for docs who are interested in doing that same thing? Because I think that it's great what we're doing, speaking to an audience of thousands, but really when you get on television and speaking to an audience of hundreds of thousands to millions, I think that really can increase our influence. And you do a great job educating patients. So how do you, what kind of tips can you give doctors if they were interested in speaking on a larger stage?
I think it's just getting out and doing it, and I really feel passionate about what I'm going to say, is that social media really has prepared me for traditional media. And what I mean by that is that, just all these years of writing blog posts really taught me to kind of craft what I'm trying to say, especially just like your previous question is, I don't have a lot of time. So it's taken me all these years to really craft what I'm going to say to get to a point where, I don't have to, or I feel comfortable just sending it out and not micromanaging everything I write. As far as for speaking, my podcast, my live podcast really has prepared me to do the live television work that I'm doing right now. Because when I started before, I did pre-recorded podcasts. I didn't like them. I didn't like how they sounded. They didn't feel genuine to me. There's something for me just going on live and just having everything recorded, which is kind of a microcosm of social media, is really kind of taught me to talk in the soundbite and say, when I go on television, even though I look great, I have 2 minutes to get these 4 bullet points out. And I know that the anchor is going to push me or ask me, a question to get me off track. But I know that especially when you're doing television work, pretty much, you don't get any kind of random question. Either they give me the topic or I give them the topic. And before I go in there, I tell myself, these are the 4 points that I'm going to talk about. And whatever question they ask, I'm going to tell them the 4 points, and I think that's what I learned from like political media work too, is that, whatever question they ask you, spin them back to what your message is.
Stick to your talking points. That's right. Yeah.
Stick to your talking points and just to do it. I did a lot of local stuff before I got on television. Yeah, I spoke at community organizations, and I did awful there. I did awful PowerPoint presentations. I learned from my mistakes, and so what I tell docs is that you're not going to be perfect first time out, but you got to do it. And I remember when you came on my show the first time, I asked you about writing letters to the editor, and you're like, well, go to this website and just write them. So I wrote them, and the first one were pretty bad. But as time goes on, you get better and you get better and you get better. And I know docs just want to go out there and look professional from the start. It's like anything else. I mean, it's you have to keep doing it and you have to keep practicing it. You're not going to be perfect, especially when it comes to advocacy, and because I tell docs this all the time, the 2012 election is going to be right around the corner. Docs are going to have to, talk to representatives and Congress people about what is important to us, and we're only going to get X number amount of minutes. It may not even be with the congressman. It may be with their staff members, who's more important. But these are the talking points. You got to practice to do it. So what I tell docs is just do it. You're going to mess up the first time, but as time goes on, you're going to get better.
Absolutely. I think what you said at the beginning, social media preparing you for mainstream media. That's a key point, especially for my blog writing, preparing me to write my columns in USA Today and New York Times and my local papers on CNN.com. And I wouldn't have had that experience if I didn't write blog posts. In fact, a lot of my columns and op-ed pieces they start as blog posts. So I think if there's one take-home message, is that for doctors who are interested in speaking on a larger platform, is that social media really does give you the foundation to move on to bigger platforms.
Great. And you have any other questions? I'm getting better at this.
I know. No, I think it's great. I think what you shared was just fantastic, and that's great advice.
Great. Well, Kevin, thank you so much for coming on the show. Thank you for participating in my new little experiment as I am trying these video and audio kind of pre-recorded type things for my show. Best of luck when you talk at Austin, and I know I'll be watching live on Ustream, and let me give people that information again. That's going to be on Friday, January 28th at what I have here is at 8:40 a.m. I presume that's Central Time, because that's in Austin. And go to texmed.org, and they'll probably have a link there, and you'll probably have a link as well on KevinMD. So, so Kevin, thank you so much. So you're on Twitter, you're everywhere. So what links would you want to mention before you close things out
Just
here?
go to my site, KevinMD.com, and if you're interested in following me on LinkedIn, Twitter, Facebook, those icons are displayed prominently. So I'm looking forward to the engagement at the Texas Medical Association. Let's pray for some good weather, and hopefully I don't get snowed in Boston. But otherwise, if the weather holds out, I'm looking forward to speaking.
Great, great. Thank you so much for the time, Kevin. KevinMD.com. Thank you so much.
Very good. Thank you, Dr. A.